Hello, welcome back again for the Quad Life. Well, yesterday we talked about my ventilator and now diaphragmatic pacemaker. And one thing that I forgot to talk about is that I am able to breathe on my own a little bit, that I can use my neck muscles to suck in some extra air. And I especially do that if I need to speak louder, such as a couple weeks ago when I did my fair video. You could see me doing it quite a bit to try to let the camera speak, or let the camera pick me up with all the other noises around. But today we're going to look at my trach and trach button. Well, in order to use a ventilator, you have to have a way to, of course, access the lungs. And one way you can do it is by having a mask over your face or something that goes in your nose, or initially a tube down your throat. Well, initially, such as like with an accident, they will put a tube down your throat to your lungs and connect that to a ventilator, and that's what helps you breathe. But that isn't good for long term. And some people I have seen use kind of a cannula or something that is attached to their nose, and that works for people. Hey, that's good. But the majority of what I've seen is people will do a trach. And for 30 years, I use a regular tracheostomy that has a hole in my throat and has trach ties around your neck, and there is a big tube that then goes in the hole and partly in your trachea and down towards the lungs, that then you can attach a ventilator to. And that works quite well. We changed it about every other week, and I have a really old video on that that shows how I did my trach changes. And that's what I did, and it worked well for me and does for many people. When I got the diaphragm pacemaker, then when I had the trach, I could use a different valve that would block it off or seal the trach so that air could not go through it. And therefore, it forced me to breathe through my nose when I was on the pacemaker. And this helped me to get used to breathing that way instead of through the trach. But I'd used it before I got the pacemaker as well, in that when I would breathe on my own for practice, that I would also use this to seal off the trach, that I could just breathe through my nose as well. It was obviously just a short-term thing that I did when self-breathing, because conditions had to be just right in order for me to breathe independently. That someone has to be right there watching me. I can't be stuffed up or sitting in a bad position or that kind of thing. But the bad part about a trach is that with long-term use, it can start to rub a hole in your trachea, and there is a major blood vein around there as well, that I have heard of some people that their trach will rub a hole in this vein, and even if they're in surgery, that they can lose their entire blood volume within a very short amount of time. I've heard some say as short as 30 seconds, and others within a minute or maybe two. And after probably about 5 years of using the diaphragm pacemaker, I was having a lot of pain in my trachea because I do have full feeling there yet. And my trach kept rubbing all the time. And I had visions of these problems going through my head. So I talked with some other quadriplegic friends that use a similar system that I do, and they suggested doing a trach button, which is what you see I now have. And I got it in late 2015, so I've been using it now for about 7 years. And it is nice that it is a lot shorter than the regular trach, and it does not require trach ties to keep it in. So it has done pretty well. But there are some problems with it, like it is not easy to change. And for the past couple of months especially, I've been having a lot of problems with it, and as you may be seeing now, it's kind of red around it, and I've recently had a lot of work done to try to fix things, but just still having problems, so we'll see. But for the most part, it has worked very well. And something for both the trach and the button is that they allow me to suction through them. Suctioning is another part about not being able to breathe on my own, is that I cannot clear my lungs independently. So we put a little tube down into my lungs and suck out the extra junk that you would cough up. And it works well. And I've had some people ask me about doing a video on that, and I do not plan to, as it gets kind of gross sometimes. But those are the main things, and the last item I want to look at is that with these devices, with the vent and the trach or the button, is that they are kind of all a little bit irritating on the throat. So because of them, speaking for long periods does get to be very difficult. My throat gets scratchy, as you can hear in some of my videos for sure. And it's also part of having a spinal cord injury that's at a high level as I have. So what do? Yeah, I speak at places, which, yeah, kind of ironic, but that's me. However, if I preach somewhere or speak at a school for an hour or something, then the rest of the day I'm not maybe as talkative, but my caregiver behind the camera is grinning quite a bit at that one, so maybe not. But I think those are the main things about breathing. So next time we will continue on more aspects about living with a spinal cord injury as we continue this month of spinal cord injury awareness. So thank you very much for watching, and as always, please ask comments below, and I will either try to answer them directly or possibly with videos later on. But that's it for now. So have a good day, and bye.